Hi friends, today I'll show you how to draw the intramuscular spaces. This is a scapula with medial, superior and lateral borders with glenoid cavity. And this is the head of the humerus with medial and lateral borders. This head of the humerus is having a greater tubercle and lesser tubercles. This is the spinous process which continues as the acromion process. These are the muscles, supraspinatus and infraspinatus muscles. This is the levator scapulae and this is the rhomboides minor and this is the rhomboides major muscle. And this is the deltoid muscle and these are the supraspinatus, infraspinatus. And this is the teres minor and teres major muscle. This is the long head of triceps. So these are the quadrangular and upper triangle and lower triangle space. This is the lower triangle. After completion of this diagram, I'll explain in detail. These are the suprascapular vessels, suprascapular artery and vein. So now I am just here drawing orange color to differentiate. These are the axillary nerve with posterior circumflex humeral vessels. These are the profunda brachiae vessels with major radial nerve. These are the circumflex scapular vessels which makes an anastomosis with suprascapular vessels. This is the levator scapulae muscle and this is the rhomboides minor. This is the rhomboides major. And this is the supraspinous fossa having the supraspinatus muscle. Infraspinous fossa having the infraspinatus muscle. And this is the deltoid muscle, which is the powerful abductor. And these are the posterior division of an axillary nerve and anterior division of axillary nerve. With the posterior circumflex humeral artery and vein. This is the radial nerve which passes through the radial groove. And this is the profunda brachiae vessels which are the branches of brachial artery. This is the suprascapular vessels. And these are the circumflex scapular vessels. This is the teres minor which inserts at the greater tubercle and this is the teres major. These are the sits muscle. We'll see at the sit means SIT, supraspinatus, infraspinatus and teres minor. All these three will insert at the greater tubercle. This is the long head of triceps which originates from the infraglenoid tubercle. This is the complete diagram of the intramuscular spaces. We'll see three intramuscular spaces. First one is the quadrangular space. See, look here, this is the quadrangular space having the boundaries of above, below, medial, lateral. Above boundaries are formed by in front, it is formed by subscapularis muscle in front and capsule of the shoulder joint. Behind, it is formed by the inferior border of teres minor muscle.
Okay, these are the superior boundaries. Nothing but above we'll see the boundaries. Capsule of shoulder joint, subscapular is in front and behind lower border of the teres minor muscle. Now we'll see below. Below it is formed by the, this is the muscle, teres major muscle. Below boundary it is formed by the superior border of teres major muscle. Now medial. Medial it is formed by the long head of triceps. Look here, this is the long head of triceps which take origin from the infraglenoid tubercle. So medially it is formed by the long head of triceps, nothing but lateral border of the long head of triceps. This is the medial head, this is the lateral head. So medial boundary is formed by the lateral border of long head of triceps, whereas lateral border is formed by the surgical neck of humerus. Surgical neck of humerus. This completes the boundaries. Above, below, medial, lateral. Okay. Medial it is formed by the lateral border of long head of triceps. Lateral border is formed by the surgical neck of humerus. Lower it is formed by the teres major muscle. Superior border of teres major. Above it is formed by the teres minor. Lower border of teres minor behind. Okay. So if you see the contents, we'll see the axillary nerve and its divisions. So this is the axillary nerve. The first one is the posterior division of the axillary nerve having a pseudoganglion on it. This is the posterior branch of axillary nerve with its pseudoganglion which is supplying to the teres minor muscle. This is known as the teres minor nerve to teres minor muscle. So this is the teres minor muscle and this posterior branch of axillary nerve with pseudoganglion supplies to the teres minor muscle. And this is the anterior branch of axillary nerve supplying the deeper aspects of the deltoid muscle. Look here, this is the deltoid muscle, this one. So it supplies its deeper aspect. This is the anterior branch of axillary nerve. And these are posterior circumflex humeral vessels, artery and vein. So these are the contents seen in the quadrangular space. Next one is, this is the upper triangular. Look here. This is the upper triangle space. This one. So this upper triangular space, if you see the boundaries, above it is formed by the inferior border of teres minor. Below it is formed by the superior border of teres major. Lateral border is formed by the medial head of long head of triceps. Medial border of long head of triceps. And the contents are circumflex scapular vessels, circumflex scapular artery and circumflex scapular vein which interrupts the origin of this teres minor muscle, and then it enters into the infraspinatus fossa, make an anastomosis with the circumflex branches. These are the above vessels. See here, these are the circumflex scapular artery and vein. These are the suprascapular vessels above. These are the circumflex scapular artery and vein. These branches makes an anastomosis with these one, suprascapular branches. So these are the contents seen in the upper triangle space. Here the boundaries are above, below and lateral. Above by teres minor, below by teres major, lateral by medial head of long head of triceps. And if we see the lower triangle space, this one is the lower triangular space. Here boundaries are above, medial and lateral. Above boundaries is formed by the inferior border of teres major muscle. Look here, this is the teres major muscle, that is the superior border and this is the inferior border. So above boundary is formed by the inferior border of teres major muscle. Medial border is formed by the long head of triceps. For long head of triceps, medial border, lateral border. So this is the lateral border of long head of triceps. And then if you see the lateral boundary, it is formed by the medial border of humerus. Look here, this is the humerus bone. For it, This is the medial border and this is the lateral border. So this completes the boundaries: above, medial, lateral. Medial by the long head of triceps, lateral by the medial border of humerus, medial by the lateral border of long head of, lateral border of long head of triceps, medial by the medial border of humerus, above by the teres major muscle. And the contents are here: radial nerve. This is the key nerve. This is the radial nerve which supplies the posterior compartment of the forearm. This is the radial nerve, and these are the profunda brachii vessels, profunda brachii artery and profunda brachii vein. These are the nothing but branches of brachial artery. So this completes the intramuscular space: quadrangular space, upper triangle space and lower triangle space. So if you see the muscles, all these are the muscles. This is the levator scapulae muscle which inserts at the superior angle of the scapula, and this is the rhomboides minor and this is the rhomboides major. This is the supraspinatus muscle and this is the infraspinatus muscle, and this is the teres minor, teres major and long head of triceps, and this is the deltoid muscle, and these two are the supraspinatus, infraspinatus muscle. At greater tubercle, we will see the insertion of three muscles, hip muscles: supraspinatus, infraspinatus and teres minor. Okay. This teres minor and teres major both takes the origin from dorsal aspect of the lateral border of the scapula. From the upper two-third part of the dorsal aspect of the lateral border of scapula, teres minor will take origin, whereas the lower one-third of the dorsal aspect of lateral border of the scapula, teres major, will take origin. This completes the intramuscular space.